Hey everyone, and welcome back to the Deep Dive, your daily deep dive into important current affairs for those of you gearing up for the UPSC exams. Today we'll be pulling some insights from a recent report in The Hindu. It tackles a concept that's really quite relevant for your exams, but also just, for the world at large. Compassion in healthcare.
Yes, and it's not just a feel-good topic. The WHO report that we're looking at today makes a very strong case for recognizing compassion as a transformative force in healthcare with, far-reaching implications, especially for areas like primary care.
Okay, so it's more than just, a doctor being nice to a patient. How does compassion actually lead to, tangible benefits in a healthcare setting?
Right. Well, that's what's so interesting about this report. It goes beyond just this simple notion of, being nice. And it actually presents some pretty compelling evidence that compassion can lead to quantifiable improvements for both patients and healthcare providers. For instance, studies show that patients who experience compassionate care tend to recover faster, while healthcare professionals experience less burnout.
Produce burnout. I'm sure that's something that a lot of doctors in our really overstretched healthcare system would be interested in. Are there specific examples of how compassion makes a difference in these areas?
Absolutely. One study that was done at Johns Hopkins Hospital found that doctors who spent just 40 seconds longer with their patients, making sure that they felt heard and understood, they significantly reduced patient anxiety levels. And this seemingly small gesture actually led to faster recovery times.
Wow, that's really fascinating. Just 40 seconds can make such a huge difference. Thinking about it from a policy perspective, which is super essential for all of you UPSC aspirants out there, how can this insight be applied to improve healthcare systems, especially in India, where the doctor-patient ratio is already so strained?
Yeah, that's a crucial point. Resource limitations are a harsh reality. But even within those constraints, promoting a culture of compassionate care can have a really significant impact. It's not about adding more hours to a doctor's already packed schedule, but it's about maximizing the impact of those existing interactions. This could mean things like integrating communication skills training into medical curricula, really focusing on active listening and empathy.
So equipping healthcare providers with the tools to deliver care that's not just medically sound, but also emotionally sensitive. Now, before we move on, I want to address something that I think a lot of people get confused about. We're talking about compassion here, not just empathy or sympathy, right? What's the key distinction?
Yeah, you're right. Those terms often do get used interchangeably, but they have very different implications in healthcare. Sympathy is about feeling sorry for someone, while empathy involves actually taking on another person's pain. Compassion, however, is about recognizing and responding to suffering without becoming overwhelmed by it.
Okay, so empathy could lead to burnout, right? Especially in a field like healthcare where you're constantly exposed to suffering. Compassion, on the other hand, allows you to maintain a healthy level of emotional distance while still acknowledging and addressing the patient's needs.
Precisely. You could think about it this way. Empathy is like a sponge, absorbing every emotion around it, while compassion is more like a well offering support without depleting its own resources.
I love that analogy. It really clarifies why compassion is a more sustainable approach, especially for healthcare providers who are already dealing with so much pressure. Now, speaking of pressure, let's talk about something that is increasingly relevant for UPSC aspirants, the growing mental health crisis.
Absolutely. Mental health is a critical social issue. And the WHO report that we're discussing explicitly highlights the importance of compassionate care in this context. Unlike physical ailments, mental health issues are often invisible, and they carry a very heavy stigma, which makes it even more difficult for people to seek help.
Right, which makes compassion even more crucial in those situations because it creates that safe space where patients feel understood and supported without judgment, which encourages them to open up about their struggles.
Exactly. Compassionate care in mental health settings is about fostering trust and building that therapeutic alliance. This is especially important in India where, cultural barriers and lack of awareness often prevent people from seeking professional help.
And the report actually includes a really powerful case study that kind of illustrates this point, the story of a young boy named Pradeep.
Yes, Pradeep's story is a stark reminder of the trauma that children can face. He was rescued from a really horrific situation where he was labeled as cursed, and he was nearly sacrificed due to superstitious beliefs. He endured extreme neglect and abandonment. And when he was finally rescued and brought to Balashram, which is a long-term rehabilitation center, he was completely withdrawn, he was unable to communicate, and he was clearly suffering from severe emotional trauma.
So how did compassionate care play a role in his recovery?
Well, the caregivers at Bal Ashram recognized that forcing Pradeep to talk about his experiences before he was ready would be counterproductive. So instead, they focused on creating a very nurturing environment, allowing him to heal at his own pace, really prioritizing emotional support and understanding.
And what was the outcome of this approach?
Well, over time and with consistent, compassionate care, Pradeep began to emerge from his shell. He formed bonds with the other children. He started opening up about his past. And eventually, he regained his ability to communicate. His story is a testament to the transformative power of compassion in healing those deep emotional wounds.
That's a really incredibly powerful example. Now, for you, the UPSC aspirant out there, this case study raises some really critical questions. How can this model of compassionate care be scaled up to address the larger mental health crisis in India? What kind of policy interventions are needed to ensure that the support that Pradeep received is available to everyone who needs it? These are things that we'll explore in more detail in the next part of our deep dive. Don't forget to like, subscribe, and leave your thoughts in the comments below.
Yeah, Pradeep's story really does highlight the potential of compassion to heal. But as you mentioned, the question for a UPSC aspirant is how to translate that individual success into system-level changes. And the WHO report does offer some practical strategies for making compassion a core principle within healthcare systems.
Okay, so let's dive into those strategies. What does the WHO suggest?
Well, they outline 3 key areas of action. First, they emphasize raising awareness among healthcare leaders and policymakers. This means moving beyond seeing compassion as just a nice to have and actually recognizing it as a fundamental element that influences patient outcomes, healthcare provider well-being, and ultimately the effectiveness of the entire system.
So it's about changing mindsets at the top right, making sure that the people who shape healthcare policy understand and prioritize the value of compassion. But awareness alone isn't enough. How do you actually equip healthcare providers with the skills to, deliver compassionate care?
Right. And that leads to the WHO's second strategy, implementing quality training programs for healthcare providers. It's about equipping doctors, nurses, and really everyone involved in healthcare with those practical skills that are needed to deliver compassionate care effectively. And this could involve experiential learning, role-playing, or even mindfulness training to help them manage stress and prevent burnout.
I can see how some people might kind of push back on that a little bit, arguing that healthcare professionals are already stretched so thin and adding more training might just seem like a burden. How do we address that concern?
It's important to emphasize that compassion isn't about adding more tasks to an already overloaded schedule. It's about enhancing the quality of those existing interactions. Studies have shown that incorporating compassion into healthcare can actually save time in the long run, by improving patient compliance, reducing readmissions, and even shortening hospital stays.
That's a really good point. So it's not just ethically sound, it's also more efficient. It seems like a win-win situation for both healthcare providers and patients. But what about ensuring that this approach reaches everyone, regardless of their background or circumstances?
Right, and that's where the WHO's third strategy comes in, ensuring equitable and accessible healthcare for all communities. A truly compassionate healthcare system can't leave anyone behind. It means recognizing that every individual deserves quality treatment, irrespective of their, socioeconomic status, their gender, caste, religion, or any other factor.
And that aligns perfectly with the UPSC's syllabus, which really emphasizes social justice and inclusive development. It's not just about building hospitals and training doctors, but about creating a system that is truly people-centric, where every citizen feels valued and cared for.
Precisely. A compassionate healthcare system acknowledges the inherent dignity of every human being, and it strives to provide care that is not only effective, but also delivered with empathy and respect.
This brings us back to you, the UPSC aspirant. Thinking from a policy perspective, what are some concrete steps that can be taken to make this vision of a compassionate healthcare system a reality in India?
That's a critical question, and one that you as future policymakers will need to grapple with. The WHO report provides a really good framework, but those specific solutions will need to be tailored to the Indian context.
So it's not just about importing best practices from other countries, but about developing solutions that are sensitive to our own unique social, cultural, and economic realities. Now, as we move towards wrapping up our deep dive, let's kind of revisit the core message here. What's the key takeaway for our listeners today?
The key takeaway, I would say, is that compassion is not just a lofty ideal. It's a tangible force with the potential to transform healthcare systems for the better. It leads to improved patient outcomes, greater job satisfaction for healthcare providers, and ultimately a more just and equitable society.
And for our UPSC aspirants out there, This topic offers such rich material for essay writing, ethics papers, and even interviews. Understanding the nuances of compassion in healthcare, analyzing its challenges and policy implications, could give you a significant edge in the exams.
Absolutely. It's a topic that goes beyond mere knowledge and touches upon values and vision, something that the UPSC is increasingly emphasizing in its selection process.
All right, folks, we've covered a lot of ground today, from defining compassion to exploring its practical implications for healthcare systems. Now, in our final part, we'll shift gears and focus on the individual level. What can you do as a future civil servant to contribute to a more compassionate healthcare system? We'll delve into that along with some final thoughts and action steps in the next and concluding part of our deep dive. Welcome back to the final part of our deep dive into compassion in healthcare. We've explored the what and the why. Now let's really get into the how. We talk a lot about, system level changes, but what about at the individual level? What can you as a future civil servant do to contribute to a more compassionate healthcare system?
Yeah, that's such an important question, and it's one that I think every UPSC aspirant should be thinking about. While policy changes are, super crucial, the real transformation actually happens on the ground, in those daily interactions between healthcare providers and patients. And as future civil servants, you'll be in a position to influence both the macro and micro levels of the healthcare system.
Right, so it's not just about drafting those policies, but also about setting an example, right? Fostering a culture of compassion within the institutions that you'll be leading.
Absolutely. Think about the values that you want to embody as a leader. Are you approachable? Are you empathetic? Do you really listen to the concerns of your team, including those healthcare workers who are on the front lines? These qualities can go a long way in creating a work environment where compassion can truly thrive.
I see what you mean. Leading by example can have that ripple effect, right? Influencing not just your immediate team, but the entire organization. But okay, let's get a bit more specific. What are some concrete actions that our listeners can take, maybe even before they, officially enter the civil services?
Yeah, well, there are actually a lot of different avenues for action. You could volunteer at a local clinic or hospital, gaining that firsthand experience of the challenges that both patients and healthcare providers face. You could advocate for, increased funding for mental health services. Or you could support initiatives that promote awareness about mental health issues within your own community.
Yeah, those are really great suggestions. It seems like even those seemingly small actions can really contribute to that larger shift towards a more compassionate healthcare system.
Yeah.
Now, before we wrap up, I want to go back to something that we discussed earlier. The toll that empathy can take, especially on those working in healthcare. How do we encourage compassion without leading to burnout?
Yeah, that's a very important consideration. Compassion fatigue is a real phenomenon, and it's absolutely essential to equip healthcare providers with the tools to protect their own well-being while they're caring for others. Mindfulness training, stress reduction techniques, even peer support groups. These can all be incredibly valuable resources.
So it's about recognizing that self-care isn't selfish. It's actually essential for sustaining compassion over the long run. And that's something that policymakers need to be mindful of as well, right?
Absolutely. A compassionate healthcare system also cares for those who are providing care. This means ensuring fair working conditions, reasonable workloads, and access to support systems for healthcare professionals.
That's a really great point to end on. I think we covered so much ground today, from, that individual level all the way to those system level changes, exploring this really complex nature of compassion in healthcare.
Yeah, and as we wrap up, I want to leave our listeners with one final thought. Compassion isn't a finite resource. The more we practice it, the more it grows, not just within ourselves, but also within our communities and our institutions.
That's a beautiful and inspiring thought. So the UPSC aspirants, as you continue your preparation for those exams, just remember that knowledge is only one part of the equation. Cultivating compassion, empathy, and a genuine desire to serve. That will make you not just successful candidates, but also really effective leaders who can make a true difference in the world. Don't forget to share your thoughts and insights in the comments below, and subscribe for more deep dives into these crucial current affairs.
Until next time, may you all stay compassionate and inspired.
This deep dive was based on a report covered in The Hindu.